Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. I'm Rahma Rana and I'm doing BS in microbiology from UMT and it's my third semester. Before starting my presentation, I would like to share some words of Lily Walters. Once Lily Walters said, "The success of your presentation will be judged not by the knowledge you share, but by what the listener receives." So, let's start our presentation. The topic is problems in pharmaceutical crops. Pharmaceutical crops. What are pharmaceutical crops? Pharmaceutical crops are those cultivated species that are used for the extraction or preparation of therapeutic substances such as active pharmaceutical ingredient, APIs, excipients used in the pharmaceutical formulations, vaccines, and antibodies, as well as other therapeutic proteins. Let's discuss risk and concerns. Environmental contamination include gene flow via pollen, non-target species near field sites, example butterflies, bees, etc. And in food supply, there are accidental intentional gene flow. Health safety concerns, non-target organ responses, side effects, allergenicity. Let's discuss in detail difficulties in growing advanced pharmaceutical crops. So, the cost of the risk and regulation, a major issue with crop biomanufacturing is the potential risk that may be involved. The essence of the problem is the reliance on crops that until now have been used exclusively for food or feed to produce bioactive compounds which may under certain conditions turn out to be toxins, allergens or to have hormonal effects. In Pakistan, the advanced cultivation of pharmaceutical crop faces many difficulties due to following reasons. We have power shortage, lack of new technologies, lack of trained manpower, high interest rate, difficulty in export. Let's discuss biosafety issues in pharmaceutical and transgenic crops. Although grown and handled separately, the possibility arises that these compounds intended for pharmaceutical or industrial use could end up in the food and feed supplies by accident. There is thus a real objective risk of direct harm to the human health and the environment. Relate to the environmental health and animal health consequences. Both can have short and long term implications. Biosafety risk involve the entire spectrum of the biodiversity. A universal true for all approach may not be applicable. Let's discuss some example. Risk specialist Robert Pedersen and plant biologist Charles in the February 2004 discussed the issue of trends in biotechnology, argue that while some of these proteins may be quite novel, few are likely to be highly harmful and any direct food safety risk they impose in indefinable and manageable. In short, the actual harm is highly unlikely, yet the indirect risk from such an eventually could be catastrophic from an economic point of view. An accident could call into the question the very integrity of the food supply. The food industry is particularly concerned, and both the National Food Professors Associations and the Grocery Manufacturer of America have taken strong position in favor of strict regulation to achieve maximum protection of the food supply. Biosafety concerns. Biosafety concerns may rise from the horizontal gene transfer, genetic contamination, transfer of allergens and toxins from one life to another, creation of new toxins and allergic compounds. The food industry and particularly concerned grocery manufacturers of America have taken the strong positions in favor of strict regulation to achieve the maximum protection of food supply from possible contamination by the PMPs. Indeed, the biotech industry should be extremely concerned as well, as any possible realization of the undesirable unintended effects would be seized upon by the already active antibiotic lobby and could improve crippling for future biotechnologies research. US regulation in the area is undergoing an extensive review. Current and interim regulars, however, implicitly presume a zero tolerance level for the presence of PMPs and PMPs in the food supply. Such a strict requirement may be impossible to achieve in article and may indeed impose unnecessary cost without increasing safety. Given that some of the proteins are known to pose little or no risk, whereas others pose intermediate or high risk, it would seem sensible to regulate them. differently. Let's discuss main concerns. Development of the aggressive weeds by transfer of transgenic traits in order to make better pharmaceutical crops. Erosion of land races by genetic pollution in center of origin. Harm to the non-target organisms. Development of the pest resistance by prolonged use. Regulations that impose zero tolerance across the board may result in unnecessary precautions for low risk products, while during the resolution and attention spent on the high actual risk, yet the overriding objective of the preserving public confidence in the integrity of food supply may require a strict and seemingly less efficient regulation. Let's discuss an example. The Prodigy incident illustrates that the potential dangers. In 2002, USDA found that volunteer corn that was genetically engineered by Prodigy. Basically, Prodigy is a small private held biotech company and a leading firm in the technology. So, by Prodigy to express a vaccine for a viral disease in pigs have contaminated by soybean fields in Nebraska and Iowa. These volunteers' plants were left over from the field test carried out. The year before, despite lack of the evidence that such a contamination posed of any health risk, the product from these soybeans, 500,000 bushels, was quarantined and eventually destroyed. Prodigy paid a fine of around about $250,000 and had to bear the cost of destroying the contaminated products, which were about $3 million. Yes, the inducing financial stress on the company resulting in it being sold to third party Stein Seed in 2003. To avoid the contamination of food feed by the PMPs, a phosphate contamination and segregation program must be put in place that will unnecessarily entail the use of the physical separation between the pharmaceutical or industrial crops and conventional feed or food crops. One low-cost spatial segregation solution would not be grow PMP corn in the corn belt. The other PMP corn in the corn belt is the suggestion is simply to use plants other than the food feed crops to produce PMP and PMP's tobacco, for example, or even duckweed. It is true that both at the research gate stage at the production stage, it is comparatively easier to use corn as the vector for pharmaceutical and industrial traits than to use, say, duckweed. But such an efficiency advantage may pale in comparison with potential costs that would rise if high risk pharmaceutical proteins were to end up in the food chain. Industrial issues of the pharmaceutical plants. Increased competition from generic drugs, legal liability of opioid addiction, product liability, keeping up with high technology, patent cliffs, expiration of the drug patent, and the sudden drop off scales of products that previously constituted a large percentage of the market. Thank you.